As a clinical nutritionist, I know firsthand the importance of understanding and managing hypertension or high blood pressure. It is a serious condition that affects over 1 billion people worldwide, and it can be somewhat life-threatening complications like heart attacks, strokes, and kidney damage if left untreated. That's why I'm passionate about helping people understand what hypertension is, how to recognize its risk factors and symptoms, and more importantly, how to prevent and manage it through healthy lifestyle changes. First, let's break down what blood pressure actually is. When your heart beats, it pumps blood through your arteries to deliver oxygen and nutrients to your body. Now, blood pressure is the force of that blood pushing against the walls of your arteries. It measured in two numbers. Systolic pressure, which is your top number, reflects the pressure when your heart beats, while diastolic pressure, the bottom number, shows the pressure when your heart is resting between beats. Now, a normal blood pressure reading is less than 120/80. If your consistently readings are 140/90 or higher, you have hypertension. Readings between 120/80 and 139/89 are considered pre-hypertension, meaning you're at high risk of developing high blood pressure if you don't take preventative measures. So what puts you at risk of hypertension? Some factors like your age, family history, and ethnicity are out of your control. But many of the most significant risk factors are tied to lifestyle habits. Being overweight or obese, eating a diet high in sodium and unhealthy fats, not getting enough physical activity, smoking, and excessive alcohol use can all increase your likelihood of developing high blood pressure. And this is based on a scientific data that was published in March of 2023, but I believe there are other factors. The tricky thing about hypertension is that it often doesn't cause noticeable symptoms, especially in its early stages. That's why it's sometimes called the silent killer. The only way to know if you have it is to get your blood pressure checked regularly by a healthcare professional. However, if your blood pressure gets very high, 180/120 or above, you may experience warning signs like severe headaches, vision changes, chest pain, dizziness, or nosebleeds. If this happens, proper breathing is essential and a grounding to help relax your mind. Now here's the good news. See, hypertension is largely preventable and manageable through healthy living. Even if you already have high blood pressure and you have been taking medications for more than 10 plus years, making lifestyle changes can actually significantly improve your numbers and lower your risk of complications. As a nutritionist, I always recommend starting with your diet. Aim to eat plenty of seasonal fruits, vegetables, lean proteins, and healthy fats. These nutrient-dense foods provide essential vitamins, minerals, and fiber that supports healthy blood pressure. On the flip side, limit your intake of white table salt, trans fats, modified fats, and added sugars. Processed foods, fast foods, and sugary drinks are major culprits to try to minimize these in your diet. Now, getting regular physical activity is another key piece of the puzzle. See, exercise helps your heart become stronger and more efficient at pumping blood, which lowers the pressure in your arteries. Aim for at least 150 minutes of moderate intensity aerobic activity like brisk walking, or 75 minutes or vigorous activity like jogging per week, plus strength training at least twice a week. If you're not used to exercising, start slow and gradually build up your endurance and intensity over time. Managing stress is also crucial for blood pressure control. When you're chronically stressed, your body stays in fight or flight mode, which keeps your blood pressure elevated. Find healthy ways to cope with stress, such as deep breathing, meditation, yoga, or spending time in nature. Getting enough quality sleep, 7 to 9 hours per night for most adults, is also freaking important, as sleep deprivation can actually contribute to high blood pressure. If lifestyle changes alone aren't enough to bring your blood pressure into a healthy range, your doctor may prescribe medications. There are several types of blood pressure drugs, including diuretics, ACE inhibitors, ARBs, and calcium channel blockers. These work in different ways to help relax your blood vessels, but major side effects are caused. But continue watching, as there are many alternatives you can take instead of drugs. as most drugs will hide the symptoms, but your systolic and diastolic will continue being high, and they will continue putting stress on your arteries. Now, at the end of the day, the key to preventing and managing hypertension is consistency, making healthy choices most of the time, even if you tend to slip up occasionally, can make a big difference in your blood pressure and overall health. And remember, you don't have to do it alone. Seek support from loved ones, join a health-focused community or support group, and don't hesitate to ask your healthcare team for guidance. In my practice, I've seen countless patients turn their health around by committing to a heart-healthy lifestyle. One of my clients, a 45-year-old man named John, came to me with a blood pressure reading of 155/95. He was overweight, stressed out from his high-pressure job, and relied heavily on fast food and sugary snacks. Now together, we created a plan to overhaul his diet with more whole foods, establish a regular exercise routine, and implement stress management techniques like meditation and setting boundaries at work. Within 90 days, John's blood pressure had dropped to 128/82, and he reported feeling more energetic and clear-headed than he had in years. So John's story is just one example of the transformative power of lifestyle medicine for hypertension. No matter where you're starting from, small sustainable changes can actually add up to big results over time. And the benefits go far beyond just lowering your blood pressure. You'll also reduce your risk of other chronic diseases, improving your mental health and cognitive function, and of course enhance your overall quality of life. So if you are ready to take control of your blood pressure and your health, here's your action plan. 1. Schedule a checkup with your doctor to get your blood pressure measured, or get it done at home with a wearable device that I currently wear myself, as you can see, but should be done 3 times a day for 3 consecutive days. 2. Start a food diary to track your current eating habits and identify areas for improvement. Gradually replace processed foods with more whole food options. 3. Find a form of physical activity that you enjoy and can stick with long term, whether it's walking, dancing, cycling, or strength training. Aim to move your body most days of the week. 4. Practice stress management techniques daily, even if it's just for a few minutes at a time. Deep breathing, progressive muscle relaxation, and mindfulness meditation all are great options. 5. Quit smoking and limit alcohol consumption to no more than 1 drink per day for women or 2 drinks per day for men. 6. Get support from friends, family, or healthcare professional to help you stay accountable and motivated on your health journey. 7. There are multiple supplements that I can guide you with to fulfill missing gaps. Remember, hypertension is a serious condition, and it's also highly treatable and reversible by making your cardiovascular health a priority and adapting a holistic lifestyle approach. You can lower your blood pressure, reduce your risk of complications, and feel your best at any age. As a clinical nutritionist, I'm here to support you every step of the way. So let's work together to create a personalized plan that empowers you to take charge of your health and thrive.